What is stereotyped behavior? These are behaviors that manifest as restrictive and repetitive behaviors that interfere with your son or daughter's day-to-day functioning. Some examples you may see are body rocking, hand flapping, tiptoe walking, lining up of objects, looking at parts of objects through the corner of their eyes, repeating words or phrases they have heard, or repeating what you say. Behavioral skill deficits are those behaviors they are not doing enough of for their chronological age. Some examples are they are not making adequate eye contact or responding to their name when they are called. Perhaps they are not yet talking, or maybe they are not speaking enough. They do not communicate their needs or wants verbally or non-verbally. They do not play with toys as they are tended, and they show little to no interest in their peer group. With ASD, because it is a spectrum disorder, no two individuals are going to present the same. In addition, just because a person has an ASD diagnosis does not mean they are cognitively affected. Many individuals with ASD fall within the average range or higher for cognition. Here are some additional developmental items you may want to consider. By 6 months, they start to become aware of their surroundings and look at things nearby. They begin to bring items to their mouths, becomes curious about things in their environment and reaches for items further away, begins to pass things back and forth from one hand to the other. By age 1, they are looking at the right picture or thing when it's named, imitating gestures from people nearby, starts to use things correctly, for example, drinking from a cup or brushing their hair, puts things in and takes things out of a container, follows simple instructions like pick up the toy. By 18 months, they can identify common items such as a telephone, hairbrush, or spoon, points to get the attention of others, shows interest in a doll or animal, can identify body parts by pointing, scribbles their own name or scribbles on their own, can follow one-step verbal instructions like sit down or come here. By age 2, they begin to sort shapes and colors, can complete sentences and rhymes in familiar books, play simple make-believe games, builds toys such as towers of 4 or more blocks. They can follow 2-step instructions such as pick up your shoes and put them in the closet. They start to name items in a picture book such as a cat, bird, or dog. By age 3, they can work toys with buttons, levers, and moving parts. They play make-believe with dolls, animals, and people. They do puzzles with 3 or 4 pieces. Understands what 2 means. They can copy a circle with pencil or crayon. Turns book pages one at a time. And can build towers of more than 6 blocks. Screws and unscrews jar lids or turns a door handle. Age 4, they start to name some colors and numbers, understand the idea of counting, start to understand time, remembers parts of a story, understands the idea of same and different, start to copy some capital letters, understands and plays board or card games, tells you what they think will happen next in a story. By age 5, they count to 10 or more things, can draw a person with at least 6 body parts, copies and prints some letters or numbers, copies and draws shapes, knows about things used every day like money and food. When considering these milestones, it is important to remember that the symptoms of ASD must appear prior to the age of 3. So now that you have a medical diagnosis, what do you do next? You will want to contact your health insurance plan and ask whether your plan covers the Applied Behavior Analysis benefit. If yes, then you will want to ask for a list of in-network providers and begin calling those providers to confirm they are in-network for your health insurance plan. If you have any questions or would like to speak to one of our exceptional team members about our intake process, please give us a call at 855-581-0100.